Uh, Good afternoon. My name is Dr. Damir Shakambet. I'm calling from Biomedic Center, which is a part of the British Society for Bioregulatory Medicine. And today I'm going to try to present integrative approach to the management of the patients who are receiving chemotherapy and radiotherapy. Bioregulatory medicine is an attempt to integrate various methodologies according to the system biology. And as such, we see that as a next step in evolution of medical thought, able to fully integrate within conventional methodology which are present and practiced today. I'm organizing this lecture together with my colleague, oncologist, Dr. Athanasios Voluminos, who is an oncologist in Athens, and I myself am a specialist in bioregulatory medicine. We're also running specialist courses. You can, if you're interested, you can have a look on our website. So therefore, today's topic is to try to apply additional medical treatments in between, for example, two chemotherapy or radiotherapy sessions. We find that the most detrimental aspect of chemotherapy is actually when certain side effects kick in after the treatment, which is just varying from myelosuppression and some other side effects. And we find that cancer cells or any other malignant process actually gets the breath back, so kind of develop more cells, and therefore until the next chemotherapy the proliferation of the cancer cells is counteracting to a large extent, in some cases, positive effects of the oncological treatment. So we thought that if we insert bioregulatory treatment in between, we are going to have benefits of increasing chemotherapy effectiveness, neutralizing side effects, and also shortening the recovery phase after the sort of post-chemo radio treatment. We know that there are quite a large amount of side effects which are varying from chest pain, constipation, diarrhea, nausea, up to the more important one from our bioregulatory point of view, which is basically suppression of the immune system. And immune system is a part of the wider system which we call PNE, psychoneuroimmunoendocrinology, and as such it is crucial in regulating health, and certainly it's important to have it fully functional in some such chronic and severe disease like malignant disorders. So therefore our approach is to decrease side effects and to increase survival. But before I actually go for the protocol itself, let me just explain to you in a couple of important slides which are going simultaneously with my lecture about what is a bioregulatory medicine. What are the principles? Obviously, the first principle is bioregulation or homeostasis, which was described all the way back from Canon. It's very well understood. It's kind of way of how it regulates various functions in the body. We find that all the healing potential of the body and subsequent cure with conventional treatments will be increased if the homeostasis is functioning at its optimum. If it is not functioning at optimal range, particularly immune system, obviously the chances of effectiveness of any concurrent treatment are going to be diminished. As you can see on the slide, simple homeostasis is based on the 5 principles, which is input to the system itself, whether it is a cellular regulation or hormonal or whatever. Every homeostatic system is effectively a system regulated with therefore input information, output, which is then as number 5, as you can see, regulating the function itself. So it's actually a self-regulating, almost cybernetic system according to the winner, which has described that principle. If you take that principle and look into the overall physiological systems of the overall body, then we shall find that higher systems are PNE and lower systems are GRS, which is effectively regulating a cellular function. And cellular function is not only the cell itself or the cells themselves, but it's also the space in between the cells, intercellular space, or the matrix. We call it actually ground regulating system, and some of our colleagues, Dr. Bourne mentioned it's a clinical ecology. signifying that it's almost like a biological terrain. So you're going to find in further slides interchangeable terms, biological ecology, biological terrain, which are signifying those lower ground system control. So therefore, in a nutshell, in bioregulatory medical approach, we are trying to regulate higher systems, lower systems, their interrelationship, stimulate homeostasis, and that is the foundation on which we are hoping to have the positive effect in conjunctions with a concurrent treatment. So effectively we are talking about here paradigm shift from linear to sort of a relational type of the treatments which are based on system biology, and instead of linear and unifactorial system, we are looking into the multifactorial way. So therefore our treatment is usually having different facets, 5, 10, 15 different treatments, which are all part of that algorithm or the pattern of disease that patients show. So in a way it is a personalized approach to each patient. So therefore protocols are personally devised depending which homeostatic system is impaired. As you can see on this slide, there is a development of disease going, as we called it, early phases of disease process. We labeled it dysfunctional phase when most of the laboratory findings are completely normal, but patients are showing early sign of homeostatic dysregulation. In the following stage there is already inflammation, acute often, which then, if not dealt by either by treatment or spontaneously by the healing power of the body, which Hippocrates called vis medicatrix naturae, he basically thought of homeostasis. It's moving into the next stage, which is a chronic inflammation leading directly to degenerative process. The process can last from a couple of months to often many years, decades, before the patient enters this degenerative phase. And of course the final phase would be malignant phase. Dr. Reykjavik, one of the German physicians, called it the differentiation phase, which is basically an oncogenesis, the process of metaplasia, anaplasia, and development of the cancer or any other malignancy. So therefore we find that the etiology of malignancy is linked, beside all these modern theories of genetical mutations which are effectively the creating malignancy itself. We are talking about damage of the homeostatic systems in the course of time. For example, stress, unprocessed feelings, emotions can also contribute to these dysregulations of the PNA, or the P part of the PNA, psychological part of the PNA. Lower system changes such as hypoxia, acidity, cumulative toxicity in the tissue and the matrix, intercellular space. Oxidative damage, blocking apoptosis, genetic and mitochondrial mutations as a final phase of that process. Certainly we shouldn't forget chronic inflammatory changes, which I already mentioned. So these are all kind of the set of the changes and alterations of the homeostasis which we try to somehow regulate. On these slides you can see the treatment based on these principles. On the left hand side you will see the PNA treatments, which are ranging from psychosomatic, immunomodulation, endocrine regulation, rebalancing of the autonomic nervous system, while on the opposite side, in a sort of blue hue, you will see the columns which are relating to the cellular regulation and intercellular, which we call biological terrain. They're ranging from alkalizing the body, alkalizing the terrain, either by detoxifying or by stimulating microcirculation, by stimulating lymphatic and capillary flow, which obviously has a double effect, bringing more nutrients into the cell and also aiding the process of lymphatic detoxification, the drainage of the side metabolites of the cellular function. Not mentioning externally generated toxins which come from the environment, that I will mention a little bit later on. So some other treatments including oxygen regulation, antioxidant therapy, microbiome. So these are all the part of the regulating the lower system of control. So just to summarize, the most important one, you will see the list of these processes which are important to regulate the lower ground system. So therefore, ground regulating system is including evaluation and correction of hydrations, nutritional excess or deficiency, tissue acidity and regulation of the acid-base status, assessment of the microcirculations of the tissue. Lymphatic capillaries are obviously regulated by the autonomic nervous system, so sympathetic and parasympathetic. So therefore that imbalance is also creating quite diminished flow within the matrix itself. So as you can see, all of these things are part of our physiological knowledge, but very rarely they are used clinically. So this is basically the gap that we try to sort of patch up by applying this bioregulatory approach during the very sort of strenuous chemoradiotherapy treatments that patients are exposed. So that is a perfect example where integrations of the different medical thoughts can actually come to the benefit of the patient. Just to complete the list, beside the hydrations, nutritional excesses, tissue acidity, there is also assessment of the autonomic nervous system. The responsiveness of the cellular receptors is therefore increased, so we're talking about positive effect on the hormonal stimulation and neurotransmitter stimulation. I'm going to mention them again when I just talk about regulations of the higher systems. So therefore, various aspects of the remineralizations and is very important. There are some syndrome called tissue damage syndrome, which is happening when the imbalance of the crucial minerals are disturbed, such as potassium, which is bringing unstructured water within the intracellular compartment that is leading to imbalance and disturbed propagation of the signaling within the cell itself. So therefore cell is less able to cope with the anti-nuclear antibodies and all the other protection that the cell has against the cancer cell. So therefore regulating mineral status is very important. Iodine, for example, is very commonly deficient, but not in each patient, so we have to assess each patient itself. Vitamin D is another one. But by far the most important aspect as far as the lower system is concerned is oxidative stress and accumulations of the toxicity. For example, tissue lesions is very well known, as you can see on this slide, creating various processes starting from inflammation, destruction of the antioxidants, release of the metals and proteins such as hemoglobin and myoglobin, and interruption of the electron transport. So these are the tissue lesions as a result of the accumulation of oxidative or free radicals and oxidative stress. Toxins themselves are having a similar effect, but they are really engorging the matrix itself, creating a diminished microcirculation and certainly overloading immune system as a whole. So therefore it's quite understandable that cellular detoxification is the way to help cell recovery. Matrix detoxification is also helping lower system to function better, to receive more nutrients, and also certain immune cells which are crucial in fighting against the cancer, preventing metastasis, and certainly keeping cancer often in situ as a result of the strong cellular immune response. So therefore detoxification is having a strong preventative component, but I'm not really going to be talking about prevention now. I'm just primarily talking about specifically about the treatments during bioregulatory approach during the chemoradiation sessions. And of course excretion. Excretion is a part of the final part of detoxifications where all the nutrients can easily come into the body, and detoxifying through micro detoxification all the kind of cellular and intercellular toxins, which are then excreted via hepatobiliary system, skin and mucosas. Certainly part of that would be also dietary changes. You will see on this slide detoxifying diet. Quite understandably we need to also in the dietary changes apply alkalizing process. So therefore patient usually receives quite large amount of vegetable juicing, which is actually creating that sort of alkaline environment. Rehydrating and alkalizing environment is helping the healthy response of the matrix itself. Avoiding certain carbohydrates, particularly the sort of glucose or high glycemic carbohydrates, improving blood supply, hypothermia, and use of certain systemic enzymes is also very important to keep fluidity of the matrix and intracellular function. Effect of the systemic enzymes is, for example, in dissolving adhesion fibrin, which is thinning the cancer membrane, making it more vulnerable to the chemo and radiotherapy treatments. It is also promoting tumor necrotic factors and inhibiting metastasis, besides some other positive effect, like for example diminishing plaques, arterial plaques, slowing down atherosclerosis. So therefore systemic enzymes are helping the sort of fluidity of the matrix, and the different kind of enzymes, they're called systemic enzymes, not those digestive ones. Systemic enzymes would be nattokinase, seraptase, besides well-known one extracted from some pros, for example papain is extracted from papaya, bromelain, etc. Tissue acidity is a very key process, because as we know in cancer tissue we have got switch into the anaerobic, because cancer cells are very energy demanding, they are releasing huge amount of acidity, and there's even theory that one of the key etiological factors is tissue acidity, because of already mentioned dietary sort of low glycemic carbohydrates, impaired microcirculations. So these are all the factors, hypoxia, these are all the factors which are perpetuating and creating cancer in the first place. Once you have a cancer, then you have to deal with hypoxia as well, which is therefore including alkaline diet, relaxation, relieving stress, hyperoxia, high perfusion, beside already mentioned detoxifications. So different buffers are therefore used, usually sodium bicarbonate, potassium bicarbonate, and you can see on this slide certain aspect of increased acid production and diminished acid elimination can increase tissue acidity. Deficiency of alkaline minerals such as calcium, magnesium, potassium certainly need to be substituted. Part of that process is faulty aerobic respiration. We know the normal path of synthesis of ATP in creating sort of healthy alkaline environment. When you have anaerobic respiration due to lack of oxygen, for example, or hypoxia, then we have switched onto the anaerobic one, which is releasing huge amount of lactic acid, beside being energy inefficient. That is why in a cancer process we have got patients who are losing weight, who are becoming even more acidic, so it is like a perpetuating cycle, which we therefore need to help patient to come out of by supporting alkalizations and supporting biological terrain by stimulating aerobic respiration. Alkalization can be done by, as you can see on this slide, by various supplements. They can be applied by intravenous treatment or peros orally. Certainly alkalizing diet, which already has been mentioned. Oxygenation can also include stimulating and supplementing certain factors which are known to be part of the oxidative phosphorylation intracellular Krebs cycle, which is of course eventually ending with the electron transport and resynthesis of adenosine triphosphate, ATP. So these are the list of the factors such as certain vitamins like C, D, E, etc., which can be given in pretty high concentration in order to help and to aid the process of sort of diminishing acidity in the body. Another slide where you can use more invasive oxygenation treatment, such as ozone. and also hydrogen peroxide can also be used. Ozone therapy is particularly effective to quickly oxygenate sort of area of the body which are acidic, and that most definitely is helping the kind of effectiveness of chemoradiotherapy. Another aspect which is often overlooked is a regulation of microbiome. Microbiome is regulated by different means, usually application of prebiotics, probiotics, and in that actual way you are creating a positive set of bacteria which are first of all less acidic, which are also showing capacity to help with the digestion, producing certain enzymes, even producing some vitamins. So therefore healthy microbiome is definitely one homeostatic system that is helping overall health and increasing chances for survival. As you can see, the whole process is pretty comprehensive. So to stimulate homeostasis can be done just in a haphazard way, to just do alkalinity, but that certainly wouldn't be efficient. In our bioregulatory course, we are going systematically through the system organization by creating a protocol based on very systematic approach to every aspect of the systemic control of the homeostasis. The best example would be inflammation. You can see in this slide that nuclear factor kappa B is very well known to switch for the inflammation process. Acute inflammation is often a healing process, helping and aiding recovery of the body, either because of the injury or some sort of inflammatory agent that body is trying to process through inflammation. Chronic inflammation is different. That means that either the body is inefficient in excreting a certain primary cause for inflammation, or there is no capacity of the body to complete its inflammatory pathways, which are controlled by various sort of cytokines, some of them pro-inflammatory, some of them anti-inflammatory. Nuclear factor kappa is important because if you have a chronic inflammation, it is also switching apoptosis and diminishing DNA repair, perpetuating genetical mutations, which is a part of pathogenesis or oncogenesis as well. So therefore, regulating inflammation would be the part of the treatment, but we usually do not use steroid treatment for chronic inflammation. As you can see on this slide, you have often blocked Th2 state, and Th2 lymphocytes are those which are producing set of cytokines which are basically anti-inflammatory. So we have got preponderance of the Th1 or pro-inflammatory type of the lymphocytes. So therefore it is a sympathetic part of the process of balance between the sympathetic and parasympathetic. So therefore we have to find a way to stimulate parasympathetic one, Th2 lymphocytes, through all the measures that we already mentioned. Certainly to assess inflammatory stage of each patient is always helpful. There are certain markers such as interleukin 6, interleukin 8, CRP, C-reactive proteins, etc., plasminogenic activator, type 1 factors. So there is a way to have pretty clear assessment about the level of inflammation. Certainly anti-inflammatory diet is one way to deal with that, avoiding exposure to different toxics, environmental toxins, preventing and treating chronic infections certainly, and already mentioned detoxification, alkalizations, and antioxidant therapy. So as you can see, it's a pretty intensive protocol. I have to mention that the protocol is not applied in a sort of uniform way. I think I did mention already that it's personalized, which means personalized protocol that every patient needs to be assessed, level of inflammation, level of oxidative sort of damage. So for example, for oxidative damage, we can actually apply different kind of the panels which are measuring the level of oxidative damage, and by doing so we can actually apply a very strong antioxidant treatment. Anti-inflammatory treatment, going back to inflammation, can be dealt with for example, regulating omega, those polyunsaturated fatty acids. We know that in today's diet there's a prevalence of omega-6 and unfortunately saturated one, which are highly carcinogenic, particularly trans fats. So therefore, patients who are under chemoradiotherapy, they have to be very precise about diet, preponderance to the omega-3, to balance omega-3, omega-6 ratio, which is unfortunately disturbed. So therefore, that would be the kind of set of protocols applicable to the regulations of the lower ground systems, or biological terrain, if you prefer colloquially. Another aspect would be a higher system of control, or PNA, psycho, neuro, immuno, endocrine. So we have to deal with each aspect of this higher system. When you're talking about that letter P within the PNA, we're talking about psychological and stress, and relieving the stress in the patients. However, those systems are in hierarchical order, which means that higher system is a psychological control, controlled by certain emotional centers, but there is actually even one system above that, which is a consciousness. When we say consciousness, the first word which comes into mind is the spirituality. So I feel that it's perhaps time that in medicine we introduce metaphysical aspect of the health, which is a spiritual realm, awareness and the consciousness. On this chart you will see some sort of level of consciousness which is measured from 0 to 1000. So we are trying to engage the patient. So it's also patient's related treatment. Instead of patient passively receiving treatment, I think that patient needs to be involved into the process, find some specific reasons for his or her stress, increase level of consciousness and awareness about health, about life in general, because the patient drive and is actually often the engine for the cure, increasing probability of survival, increasing effectiveness of overall treatment. So therefore, consciousness is the first one, as at the very top of that hierarchy. But then we're also talking about relieving stress and finding the way to move, as Saley described the process of stress, which is involving sympathetic system, which is basically a conflict phase, before actually the stress is processed, moving into the healing phase, which is a parasympathetic oriented type of the system. It's not only autonomic nervous system which is part of the stress, it is also hypothalamic pituitary axis, which is inevitably activating cortisol. Saley described that mechanism of the stress. So we somehow need to aid process of resolving the stress. The treatment itself and the fear of treatment, conventional treatment, fear of dying, is additional stress. I'm talking about some stress which is preceding and possibly even driving process of carcinogenesis in the patient. So therefore, that P from PNA is a very important part of the overall treatment, increasing and engaging awareness, relieving the stress by different psychological, psychotherapeutical. We prefer a psychodynamic approach, body-oriented approach, relieving the stress. So that would be certainly the part of the protocol. Idea is to move the patient from conflicting sympathetic into the vagotonic or healing phase, and certainly that is going to release more, if I may put it, energy into the process of healing, which is, when I say healing, as Hippocrates signifying vis medicatrix naturae, that's basically homeostasis, supporting homeostatic mechanisms, and with a possibly very positive effect for the patient's survival. So therefore, stress needs to be changed from maladaptations to stress, which is a sort of cementing the stress within the system, into the resolving and adaptation to health. So therefore, predominantly sympathetic phase, which is also pro-inflammatory phase, has to be somehow transformed into the parasympathetic or anti-inflammatory phase. That brings me to the next level of PNA, which is a propagation of the impulses through the nerve signaling. We know that there are various molecules called neurotransmitters, which are increasing responsiveness of the nervous system. Often those neurotransmitters are missing, or some precursors of those neurotransmitters are missing, which is a set of amino acid. We know that neurotransmitters either can be excitatory and stimulatory, like acetylcholine, dopamine, serotonin, etc. I'm not going to talk in details about regulating neurotransmitters, but basically we do the panel in which we assess all the precursors and amino acids missing in the body, including the neurotransmitters, and then we are applying set of amino acids in order to, for example, in dopamine, that would be tyrosine, L-dopa, which is creating dopamine. So we would assess level of tyrosine, L-dopa, and certain cofactors, which is usually zinc, magnesium, set of vitamin B, in this case vitamin B6, etc. So we are actually trying to regulate homeostasis or production of these key neurotransmitters, which is serotonin and dopamine, beside noradrenaline and also some others. It may sound illogical to regulate neurotransmitters when you have a patient suffering from cancer. But the whole principle is based on optimizing overall homeostasis, higher and lower systems of control, of homeostatic control. And by doing so, you are creating a better capacity, better responsiveness to any treatment, in particular such sort of harsh and treatment with such sort of side effect, like, for example, chemotherapy is. So therefore we want to harness all the benefits from chemotherapy and radiotherapy and modern surgical applications by increasing the health of the patient, because often patients die from cancer not because of the cancer itself, but because after consecutive half a dozen, let's say, chemotherapy, the patient usually doesn't have energy nor will to fight more. So we have to maintain that will, we have to relieve the stress, we have to regulate homeostasis overall in this particular fashion, and then we are going to be able to harness, I believe, the benefit of the modern effective oncological treatment. Let me say a couple of words about regulating hormones, because obviously the endocrine control is a part of the PNA system. One of the important aspects is certainly regulating cortisol. On this slide you can see, I'm sure that you all remember, that pathways of creating glucocorticoid hormones from cortisol via pregnenolone, but there's also one effect onto the sex hormones, which are, it's called cortisol steal, when because of the stress, lot of precursors are going into the production of cortisol. So there is therefore lack of the hormones of the estrogen, progesterone or testosterone side. So that all has to be balanced. We have to support that axis. Cortisol is a very important anti-inflammatory hormone. It is also producing energy in conjunctions with the mineralocorticoids. So therefore it is vital for the patients to have optimal amounts of the adrenal and also sex hormones. In case of the cortisol, one of the major precursors is a DHEA, dihydroepiandrosterone. And the drop of the cortisol is going in phases. It is first affecting its precursors and eventually dropping the cortisol, diminishing anti-inflammatory capacity of the patient, which we already know. I try to explain that is detrimental for the overall health. Thyroxine is another hormone which is often disturbed. You can see in this chart the factors, how they interact with adrenal hormones. High cortisol is certainly having suppressive effect on the pituitary for TSH to produce lesser amount T4 and T3. So therefore interaction between the hormones is also another side of the story. Supporting that axis can be by, for example, supplementing pregnenolone or DHA or DHEA or both. And certainly some thyroid factors such as vitamin E, zinc, vitamin B2, B3, B6, etc. So there are known factors, cofactors, which are important in synthesis of the T3 and T4. Selenium as well, amino acids such as tyrosine, iodine, most definitely. So therefore, that is an important part of the overall protocol. We shouldn't certainly forget insulin resistance, and production of insulin growth factor, because insulin resistance is certainly part of that process. So regulating obesity, which is known to be part of the risk factors for development of cancer anyway. Let me just say a couple of words about progesterone. We know that estrogen in some women who have those gene for estrogen-related cancer is more, but more or less we can say safely that estrogen is a pro-cancerogenic hormone, which is therefore counteracted by the anti-cancerogenic progesterone effect. So therefore regulating amount of progesterone, particularly in menopausal women, is very important because of regulating estrogen-progesterone ratio, and in addition to that also having, for example, anti-inflammatory, anti-neoplastic effect. Progesterone is stimulating immune system, alleviates allergies, and many other positive effects, but obviously in conjunctions with the estrogen. So therefore that ratio of estrogen-progesterone is very important. On this slide you can actually see all the factors which can supplement and precursors which are maintaining adequate concentration of progesterone. Obviously one has to do a hormonal panel for sex hormones and apply that sort of protocol that is going to balance that aspect of the hormonal control. There are also some other substances which are known to have anti-carcinogenic effect on the basis of the homeostasis, but I think in this sort of very short presentations we thought that it would be just enough to present those basic principles of our approach. We don't have time to talk about our clinical experiences and in a little bit more details about how we apply, but on this chart you will see the summary of today's lecture presentations where we are trying to cover all the aspects of the bioregulations, homeostasis, in terms of management with the cancer patients, oncological patients who are receiving conventional treatment. Our experience is that that is certainly increasing probability of survival, probability of cure, and I hope that you're all well in this pandemic. So regards from myself and from my colleagues from London, and thank you for listening.